showing that there are some benefits in humans, yeah, as well as in rats. So we do have some evidence there, but unfortunately the message about exercise doesn't seem to get through. So the doctor is saying to the patient here, you must exercise, exercise, exercise. And the patient says, yes, but seriously, what can we do to improve our health? It's crazy, isn't it? The message doesn't get through to people. So we have to be advocates for exercise, yeah? So feel free to stop me if you have any questions. Yeah. Now the idea of neural mobilization was developed by this man, Bob Elvey. He was here in Perth many years ago, and he had a patient in his clinic. This actual patient here, that's him. Unfortunately, Bob's dead now, but he assessed this patient. She had a very painful shoulder. She'd had some trivial injury to her arm, and a very painful frozen shoulder developed as a result. But he noticed that when he gave her passive treatments, she didn't improve. Yeah? When he gave her treatments to the muscles, to the joints, she didn't get any better. But he did notice that the arm was much more painful when she was in a neural provocative position. At that time, we didn't know anything about neural mobilizations, but it helped him to formulate in his mind the possibility that nerves could be painful. So he went to the anatomy lab and he developed the brachial plexus tension test, which we now call neurodynamic testing. So it was Bob's work that helped this process along from the beginning. Yeah. Now, unfortunately, at that time, he didn't know how to treat that lady because he hadn't developed the new ideas. So she went away, but she came back to his clinic about 20 years later, 25 years later, and she's still got a very painful arm. So these things can be permanent in some people if they don't get the correct treatment. It's not so common to have this more severe end of the scale of the problem, but it can be a very painful disorder and it can give long-term problems. So we have to treat the patient carefully. Yeah. Now, since Bob's work, there's been a lot of interest in mobilization of the nervous system. And as you can see here, there's quite a few systematic reviews looking at the evidence. And it shows that some people respond well, but others not so well. So it seems that there are some subgroups of specific nerve problems that respond well to this form of treatment. That's why I think we've got to be careful not to treat all nerve disorders in the same way. We have to assess them and treat them carefully, yeah? And I'll explain about how we can assess them and treat them. Now, just to illustrate it, here's a carpal tunnel syndrome problem. And if you look at the evidence about that, you'll see the carpal tunnel has got many different subcategories. In some people, the nerve is swollen. In some people, there's increased transverse sliding of the median nerve in the carpal tunnel. In some people, there is increased sensitivity of the nerve. Some, there are strong psychological factors. Some, there are some central nervous system changes. Some, there's reduced longitudinal sliding of the median nerve. So there's all these complex changes that occur. So how can we expect to treat them all with the same treatment technique? We can't. We have to assess individual patients to know which of the patients require neural mobilizations. Yeah? It's a bit of a dog's breakfast. I couldn't find a picture of a dog's breakfast, so I put the picture of the dog there. Here we go. Now that was some news about differentiating patients. So in this study here, this group in Queensland, they got people with neck and shoulder pain and they divided them into two groups. One group received specific neural mobilizations and the other group were told just to keep active. That's, as I mentioned before, just keeping active is now what a lot of people would recommend for people with musculoskeletal conditions. Yeah? They just gave them 4 treatment sessions, that's all. They didn't treat them for months and months. And they treated them over 2 weeks. They measured many different things: the global rating of change, disability, pain, function. And they showed that this simple treatment, manual therapy, had some sustained benefits compared to doing nothing, keeping active. Yeah? So that's some good news, isn't it? When we carefully select the right subgroup of people with a specific nerve problem, the outcome is good. Now, we need to do long-term follow-ups to see if there's a more sustained benefit. But in this group with specific nerve sensitization, the right treatment can be effective. So when I showed him the evidence about this treatment technique, he was very impressed.
Run!